Peace be to you all. This is Omar Abdul Malik, physician associate and health educator. So tonight, I just got off from work, so I want to do a book review. This is one of my favorite books, Antibiotic Basics for Clinicians by Dr. Alan R. Hauser. It's called, the subtitle is The ABCs of Choosing the Right Antibacterial Agents. Now, this is the second edition. I'm sure there's more recent editions out. But I found this to be a very valuable collection in my library. I'm a hospitalist PA. If you've been following me for some time, you already know that. As a hospitalist PA, I have to have what I call a working understanding of the efficacious use of antibiotics. I'm not an expert. That's why we have an infectious disease specialist on our team with whom I can consult when we have patients who've got different antibacterial infections. I will tell you this as an experienced hospitalist PA, sepsis will kill your patients very, very quickly. It's the enemy of hospitalized patients and the clinicians who treat them.
Sorry, 5761, respiratory 5761.
Sorry. So it's very important that you recognize the signs and symptoms of sepsis. You can see that in another book that I reviewed called it was Hospitalist and Intensive Care, Critical Care Medicine Made Ridiculously Simple. But I want to talk about this antibiotic basics for clinicians. So in this book, it is divided. Oh, let me read what it says on the back of this book here. So it says Antibiotic Basics for Clinicians, second edition, shows you how to apply your knowledge of pharmacology and microbiology in order to select the appropriate antibiotic. Rather than rely on rote memorization, you'll learn the underlying rationale for treatment of common infectious disease and pathogens. The text focuses on antibacterial agents, examining individual antibiotics and antibiotic classes, as well as definitive and empiric therapies, providing a framework for prescription and clinical preparation for students training to be physicians, nurse practitioners, physician assistants, physician associates, pharmacologists, or medical technologists. Clinicians also rely on antibiotic basics for a quick reference or review. So I would say if you're a prescribing clinician, so a medical doctor, a nurse practitioner, or a PA like myself, this is of particular use to you because a lot of times many of us have taken our courses in microbiology and pharmacology maybe years ago, and we've forgotten a lot of the basics. So things like morphology, your different classifications of bacteria, so anaerobic versus aerobic, gram-positive versus gram-negative, various risk factors for nosocomial infections or hospital-based infections. So a lot of my patients here have got a lot of instrumentation done on them. So they have tracheostomies, they're hooked up to mechanical ventilation, they've got indwelling catheters or Foley catheters that makes them privy to UTIs, urinary tract infections. The ones with tracheostomies who are on continuous mechanical ventilation, or CMV, may be at risk for something called ventilator-associated pneumonia. I've seen that before. If they have G-tube, gastric tubes, they can get cutaneous infections or skin-based infections. If they have wound cares, a lot of them have got sacral wounds or decubitus ulcers or bed sores. Those can get infected. So you want to be ready to prescribe the right types of antibiotics. Usually what we do when we see signs and symptoms of sepsis, so a high-grade fever, a spike in white blood cell count, leukocytosis, the person has got altered mental status, maybe they become tachycardic suddenly, so their heart rate goes above 100, beyond their baseline. Maybe they become hypotensive. These are all, they become diaphoretic. These can be signs and symptoms of other things, but usually we also want to be very wary of sepsis. So we would prescribe something called empiric antibiotics. So usually your wide spectrum antibiotics. So something like vancomycin in conjunction with meropenem. Typically, those are less expensive. So let me go over some chapters here. This book is divided into, it has 9 chapters. No, I'm sorry. No, 9 chapters. 24 chapters. And 7 different sections. So it goes into antibacterial basics. It covers some of the anatomy of the bacteria. So your cell envelope, protein production, things you covered in your microbiology class in undergrad. Got antibacterial agents. I covered these in pharmacology, which I took more than 20 years ago. So this is a good review for me.
Attention please, it's tea time. It's tea time.
Definitive therapies, empiric therapies, as I alluded to earlier. And then the thing I like about this is it's got clinical cases in the back. So this is part 5 here. So clinical cases are really good because it'll give you a clinical case of a patient. Then you've got discussion questions, like what would you give based on the clinical case. This should help you start thinking like a clinician. For those of you guys that are in school, or even people like myself, who I have to stay sharp, just based on the patients that I teach. Then there's also, kind of doing this backwards. I should do this last. That's okay. Review questions. This is a 50 question quiz. I don't know if you can see that. So it's got the answers in the quiz. The lighting here is not good for this. I'm still trying to learn how to use this phone. But just going through this, here's chapter 16. It covers different types of pneumonia. I see a lot of this.
Respiratory to room 240B. Respiratory to room 240B.
A lot of my patients have got acute on chronic respiratory failure. So I see a lot of patients with various types of pneumonia. So I've got to know how to treat those, especially in this era of COVID. So the COVID, patients who have had COVID, it can even it'll compound the pneumonia that they've got. So I need to know how to be able to treat those, and this kind of helps keep me sharp. As I mentioned before, a lot of my patients have got Foley catheters or indwelling catheters, so they're at risk for urinary tract infections. This is chapter 17. It'll help you understand the signs and symptoms of UTIs, the most common types of bacteria that cause UTIs, so Escherichia coli, also Staphylococcus, and how to treat those things. And let's see, what's something else that I like? Oh, infective. Here's a chapter, chapter 22, infective endocarditis. You'll see this very heavily in the IV drug use population, the populations with IVDA, intravenous drug addiction. It can lead to infective endocarditis. So you got to know how to treat that. It tells you some of the causes of that disease and what types of antibiotics that you would give. And what else? Again, with the clinical cases, there was another section. Oh yeah, so here, dosing of antibacterial agents in adults with renal insufficiency. So I'd say probably 50% of my patients have got some type of renal disease, whether it's acute AKI, acute kidney insufficiency, or CKD, chronic kidney disease. A lot of them need hemodialysis 3 times a week. So we do have a renal specialist that deals with that. But it's important that you understand that a lot of the antibiotics need to be renally dosed for people who have got renal insufficiency. So again, in summary, this is I find this to be a really helpful book. I try to go through my books like at least once every 4 to 6 months per year, just to keep myself sharp. Again, it's easy to forget a lot of the information that if you're not using it every day. Every day I'm dealing with patients who have different infectious disease, but because it's not my specialty, I might just take it for granted that the ID specialist is going to kind of do his thing and give them whatever. But I need to have a good working knowledge. Again, you should too if you're as a clinician or a future clinician. So again, antibiotic basics for clinicians, the ABCs of choosing the right antibacterial agent by Dr. Alan Hauser. It's a good book. You're not going to have time to read it if you're a student, but it's good if you've got some time to kill before you start your respective programs. I think I got this for about $10 on Amazon. Okay, that's it for now. If you have any interest in being a physician associate like myself, please feel free to reach out to me. I'll put my Instagram link on the description, or you can just ask me questions in the comment section. Take care. I wish you guys the best of success in your positive endeavors.